At Dr. Helmkin Memorial Hospital in Clearwater, a town of 2,500 people located 125 kilometers north of Kamloops, who do staff members call when boiler panels malfunction or the telephone systems fail, or when they need more information about snow plowing the parking lot? How to get the generators to kick in, why the tap water is brown, how to reboot the ECG machine, how many face masks to order in the event of an outbreak, how to use the dishwasher in the kitchen, and when is the best time to have a staff party based on multiple competing schedules. While there are people who know the answer to one or two of these questions, there is only one woman who knows the answers to all of them: Pearl Broswick. Until her retirement in May of this year, virtually all 100 staff members went to her first for help with any problem. She knows how to shut off the accidental fire alarm and the main water valve. When the ER was busy, Pearl would bring warm blankets to patients or strip and scrub a stretcher to prepare it for the next occupant. And if employee morale needed a boost, she would bake for her colleagues. It is important to note that none of these extra activities were done until her own job responsibilities were complete. You may wonder what kind of extraordinary employee has this sort of superhuman knowledge, skills, and dedication. Pearl was the hospital's diagnostic imaging technologist for 38 years, and in both her professional and personal life, she has committed endless time and energy to enhancing community services for rural patrons. In addition to her diagnostic imaging technologist duties, Pearl took additional training in order to provide other services so patients could have the same healthcare opportunities that those in larger communities expect. And as the only diagnostic imaging technologist for nearly 4 decades, when she was not at work, Pearl was on call 24 hours a day, 7 days a week. On top of all this, Pearl also found time to volunteer with 4-H and Ducks Unlimited and serve as a board member on 4 community services organizations, all while raising her family. With her recent retirement, colleagues are wondering what they will do without their hospital's most valuable asset. Pearl's impact can be summed up in the following tributes. We are going to need her to write it all down so that we have a resource to turn to when she is gone. It will take 2 manuals to cover it all. It takes a very special person to do what she has done all these years. She will even sweep the hallways or wash the dishes. There is simply no replacing her. Pearl, for taking the concept of above and beyond to a whole new level, and for your decades of professional and personal service to the community of Clearwater. You are this year's healthcare hero for interior health. Generously supported by Pacific Blue Cross.